Adriana, I'll be your nursing student today. Can you please tell me your name and date of birth?
Madison Wellman, October 2nd, Carolina Space.
Okay. And I'm going to be performing a hair, skin, and nails assessment on you if that's okay.
Yes.
Okay. I'm going to wash my hands. I'm going to don on my gloves. And now I'm going to inspect the head and the scalp. Making sure that there's no bumps or abnormalities. Okay. Looking at the color. Making sure everything is normal. Okay. And then I'm also going to inspect the hair color. And I'm going to move your head. And I'm going to inspect the hair distribution. You can lay back down. Alright, and then I'm just going to ask you about how often do you shower?
Every day.
Okay. Alright, and now I'm going to inspect the skin color and make sure that there are no signs of cyanosis or jaundice or any pallor going on. Alright, everything is looking normal. Okay, and then I'm going to test the skin turgor. So I'm going to pinch right above the clavicle. And I'm going to make sure that the skin snaps right back and that there is no tinting occurring. Everything looks good. Alright, and now I'm just going to palpate the skin and feel for the skin moisture and texture. So I'm going to take my 2 fingers and feel for the texture. Okay, and I'm also going to palpate down to the lower extremities to make sure that there is no edema. Okay, now I'm going to check the skin temperature. So I'm going to use the dorsal side of my hands and I'm going to feel for skin temperature. Okay, everything looks good. And now I'm going to inspect the nails, making sure that the nail beds are normal and that the nail is at a 160-degree angle. I'm going to check the capillary refill and make sure that it is less than 2 seconds. 2 seconds or less. Okay? And I'm also going to do the same thing for the toenails. And I'm going to be also checking for any clubbing going on. Okay, and everything looks good there. I'm also going to check for any blanching. And I'm also going to inspect any lesions. So I would note that the patient has some tattoos which will be considered lesions. Okay? And then I'm going to wash my hands and document.